What's the link between lymphoma and anemia? Have you ever wondered how lymphoma and anemia are connected? Anemia is actually a common issue for many people diagnosed with lymphoma, including non-Hodgkin lymphoma. Studies show that about 40 to 45% of newly diagnosed lymphoma patients experience anemia. This condition can significantly impact a patient's health and is linked to the severity of the disease. So, what causes anemia in lymphoma patients? One major reason is anemia of chronic disease, which happens due to the body's immune response to cancer. When the body fights lymphoma, it can lead to inflammation that affects red blood cell production. Other causes include iron deficiency, vitamin B12 deficiency, and, in some cases, hemolytic anemia, where red blood cells are destroyed too quickly. A key factor is when lymphoma cells invade the bone marrow, disrupting the normal production of blood cells. Let's dive into the mechanisms behind this link. Anemia of chronic disease occurs when chronic inflammation raises levels of certain proteins, like interleukin-6. This protein increases hepcidin, which reduces iron availability for making red blood cells. Even if iron stores are sufficient, the body cannot use it effectively. Additionally, when lymphoma cells infiltrate the bone marrow, they hinder its ability to produce red blood cells, leading to anemia. In some cases, about 7 to 10% of lymphoma patients may develop autoimmune hemolytic anemia, where the immune system mistakenly attacks red blood cells. Now, why is this important? Anemia in lymphoma patients often indicates more advanced disease and can be associated with systemic symptoms like fever, night sweats, and weight loss. It also correlates with higher levels of lactate dehydrogenase, a marker that indicates tumor burden. Unfortunately, anemia is considered a negative prognostic factor, meaning patients with anemia at diagnosis may face a more aggressive disease course and poorer survival rates. When doctors evaluate patients, they often find low hemoglobin levels. Depending on the cause, the red blood cells may appear normal or smaller than usual. Elevated serum ferritin levels are also common, reflecting inflammation rather than iron overload. Managing anemia is crucial for improving quality of life and treatment outcomes. It is essential to identify the cause of anemia, whether it is due to iron deficiency or anemia of chronic disease, and address it alongside lymphoma treatment. In summary, the link between lymphoma and anemia is multifaceted, involving chronic inflammation, bone marrow infiltration, and immune responses. Understanding this connection is vital for effective management and improving patient outcomes. Always consult healthcare professionals for personalized advice and treatment options tailored to individual needs.